Good day to everyone. I am Dr. Marvins Magalong, orthopedic surgery resident from Biduna Medical Center, presenting my research entitled Cost Savings and Safety of Wide-Awake Local Anesthesia, Tourniquet, in hand and wrist surgery during the COVID-19 pandemic in a tertiary military hospital. This is the outline of my presentations. The World Health Organization declared COVID-19 outbreak as pandemic on 11th of March 2020, which had major impact and reorganization of healthcare system and services worldwide. To conserve the critical care, physical and human resources, and to protect patients, the Philippine College of Surgeons published recommendation to postpone non-essential surgeries and procedures during the outbreak. This led to an almost complete cessation of elective surgeries, which significantly increased patients seeking medical attention, including urgent and emergent conditions. In response to limited operating rooms resources and risk of exposure to virus, we adopt the non-erosion generating aesthetic technique called WALANT. This to maximize the number of cases as well as minimize patient interaction with reduced potential spread of virus. This study aimed to determine the safety of performing WALANT and cost effectivity with different hand and wrist surgeries during COVID-19 pandemic. For specific objection is to identify patient demographics, evaluate the risk of exposures to COVID-19 in terms of OR time of induction, recovery time, and estimated blood loss. And third is to identify the potential cost saving when using WALANT in hand and wrist surgery. For the methodology, this case series study was conducted in Victoriana Medical Center at the Department of Orthopedic and Traumatology during the August 19, 2020 to July 2021. For the inclusion criteria, all patients above 18 years old who consented and underwent hand and wrist surgery using WALANT technique. For the exclusion criteria, those patients below 18 years old, pregnant, with comorbids such as CKD, hypertension, diabetes, vascular insufficiency, and those patients with complex regional syndrome that had previously surgery on upper extremity, and patients psychologically challenged are excluded in this study. A specific patient who have specific procedure who underwent ORIC of the metacarpal and phalanges, screw fixation, cross pinning, tendon repair, and excision biopsy were included in this study. All collected data were tabulated to show different demographics, surgical details, and institutional costs in performing hand and wrist using WALANT technique. For the result, table 1 shows that the distribution is evident that most of the patients obtained in the study population are males, who compose 83% of the populations. For table 2, it shows that most prevalent procedure is open reduction and internal fixations, which account 20% of the distal radius fixations, followed by ORIC of the metacarpals, which account 10% of all the procedures. In all cases, we stuck to the maximum allowable dose, but the waiting time between the injection and initiation of surgery had an induction of 30 minutes. Recovery time ranged from 10 to 20 minutes, with an average of 15 minutes, while the average blood loss is reported 80 cc per all of the patient. Lastly, the typical volume of the aesthetic administered for the WALANT all procedure was approximately 42 cc. All patients subjected to this technique did not feel any pain during the surgery, providing it to have a high efficacy. And this table shows the total cost of each aesthetic procedure based on the reagent, as well as the dispensable material, including the PPE and the hospital supplies. For the total cost seen, WALANT procedure is less expensive than the most of the aesthetic procedure, being 32% cheaper than the general anesthesia and 27% cheaper than the peripheral nerve block. For the conclusion of this study, it is evident from the study findings that WALANT as aesthetic procedure for hand and wrist surgery is safe based on the lost induction time, operative time, and post-surgical length on stay in the patient to whom the procedure was administered. In terms of cost effectiveness, it's shown that WALANT is up to 32% cheaper to general anesthesia and 25% to PNB due to the lower cost of the aesthetic used in WALANT technique. WALANT technique requires simpler operating rooms, minimum number of professionals, has lower material expenditure, short recovery time, and lower hospital waste productions. Lastly, given that the COVID-19 pandemic left people with significantly lesser resources, the implementation of more cost-effective treatment and management options, especially for hospital procedure, can greatly help in the provision of better and more patient-centered. This my references. Thank you, and thank you for listening, and good day.